Hello everybody and welcome to Pathologic. Today we're going to be discussing hypersensitivity reactions. Hypersensitivity reactions are inappropriate reactions to an antigen leading to a harmful outcome. These reactions require a sensitization phase where the animal is previously exposed to the antigen and then develops an immune response. There are 4 types of hypersensitivity reactions. We will describe them as immediate, antibody-mediated, immune-complex-mediated, and cell-mediated, but some people refer to them as types 1 through 4. We will start with immediate hypersensitivity, also known as type 1 hypersensitivity. Immediate hypersensitivity reactions are your classic allergic response. These reactions result in the release of histamine and the activation of eosinophils. Example diseases include anaphylaxis, allergic asthma, food allergies, and atopic dermatitis. The sensitization phase of this reaction begins with a dendritic cell presenting antigen to helper T cells. Helper T cells then activate B cells to produce IgE antibodies, which bind to receptors on mast cells. When the antigen is reintroduced, the antigen binds to the IgE bound to the mast cells and cross-links the receptors. This results in the release of histamine and proteolytic enzymes. Release of these compounds results in smooth muscle contraction, increased vascular permeability, and increased blood flow. The immediate reaction can also be followed by a late phase response that develops 2 to 8 hours later. This is due to mast cells releasing cytokines that activate eosinophils. Those activated eosinophils then release substances that cause tissue damage. One of the main disorders associated with type 1 hypersensitivity is anaphylaxis. In this condition, the vascular permeability and smooth muscle changes are the primary effectors of the anaphylactic reaction. In this condition, you end up seeing bronchospasm, edema of the airways, hypotension, and congestion of the liver due to these vascular changes. Allergies are also a hallmark example of immediate hypersensitivity. The exact presentation depends on the organ affected, but allergies typically result in dermatologic or respiratory signs. For example, skin reactions that can occur with allergies include urticaria or hives, which is due to localized inflammation and edema from the type 1 hypersensitivity reaction. Hives are also very often itchy and may lead to self-mutilation by patients, so you may see secondary injuries on top of that allergic reaction. Next, we have antibody-mediated hypersensitivity or type 2 hypersensitivity. Antibody-mediated hypersensitivity results from a body developing antibodies against antigens that are normally found on the surface or cell of a tissue. Binding of the antibodies results in destruction of that cell or interferes with cell functions. Examples of this include primary immune-mediated hemolytic anemia, myasthenia gravis, and pemphigus. We will start with discussing classic type 2 hypersensitivity reactions like primary IMHA. In these conditions, antigen present on cells stimulates IgG and IgM antibodies to bind. That bound antibody then stimulates phagocytosis of the cell by macrophages, as well as activation of NK cells. This ultimately results in the destruction of the cell. In primary IMHA, those antibodies target normal antigens found on the surface of red blood cells. This results in the destruction of red blood cells due to that macrophage or NK cell activation. We can see evidence of this cell destruction as spherocytes on the blood smear. Spherocytes are basically RBCs that have had a chunk taken out of them by being essentially bitten by the macrophage, and so they lose their normal shape. For diseases like myasthenia gravis, antibodies against the receptor block binding of the normal ligands. Therefore, the cell is prevented from activating its normal functions, resulting in low or no activity of that cell. In myasthenia gravis in particular, antibodies prevent acetylcholine from binding at the neuromuscular junction. This results in a muscular disorder causing flaccidity of basically all of the muscles. Although this condition affects many muscles, characteristic features that we often think of are laryngeal paralysis and megaesophagus. For diseases like pemphigus, antibodies binding to a receptor actually activates that receptor, resulting in stimulation of that cell to activate its normal functions. This results in hyperactivity of that cell population. Pemphigus is an example of this, where antibodies activate proteases, which are protein-cleaving enzymes. Those enzymes target adhesions between the epithelial cells in the skin. This results in vesicles, or balloon-like lesions, due to those cells being separated from each other due to lack of adhesion. Next, we have immune complex-mediated hypersensitivity, or type 3. This reaction results from the body developing antibodies against antigens that are soluble or not associated with a cell. So these could be antigens, for example, that are in the bloodstream or within the lymph fluid. Those antibodies are going to form large antigen-antibody complexes that end up depositing in the tissues, usually within the vasculature. Those complexes stuck in the tissues cause inflammation. Examples of this condition include systemic lupus erythematosus, purpura hemorrhagica, and blue eye from canine adenovirus 1. In this reaction, the antigen in the bloodstream binds to the antibodies formed by B cells, resulting in these large antigen-antibody complexes forming. Those complexes then lodge in the tissues, often in the vasculature, and stimulate inflammation and thrombosis. Systemic lupus erythematosus is a condition where antibodies target DNA and nucleoproteins in a variety of tissues. Common outcomes of this condition include glomerulonephritis, arthritis, and vasculitis around the body. Purpura hemorrhagica is a potential consequence of Streptococcus equi infection, otherwise known as the Strangles bacterium. In this reaction, antibodies target M protein from the bacterium, resulting in large antigen-antibody complexes that form and embed in the vessel walls. Ultimately, this results in vasculitis, which can cause skin necrosis and multifocal petechiae. Canine adenovirus 1 can cause a condition called blue eye due to antibodies targeting viral antigen. In this particular disease, the antigen-antibody complexes cause severe damage to the corneal endothelium, resulting in corneal edema. This condition can also occur after vaccination with the modified live vaccine in some cases. Finally, we have cell-mediated hypersensitivity, or type 4 hypersensitivity. This condition is also called delayed type hypersensitivity, due to activation of sensitized T lymphocytes as its core feature. This is because these T lymphocytes take around 24 to 48 hours to fully activate. Examples of cell-mediated hypersensitivity include the tuberculin response and Johne's disease. In this reaction, helper T cells that are pre-sensitized to a particular antigen are going to respond to dendritic cells that are presenting that antigen. The helper T cells are then going to recruit neutrophils and macrophages to the site of that antigen, which causes local tissue damage. In some cases, cytotoxic T cells can also be activated, which triggers apoptosis in affected cells. We can actually utilize this type of hypersensitivity reaction to diagnose prior tuberculosis exposures. To do this, we inject antigens against Mycobacterium under the skin to see if it triggers a cell-mediated hypersensitivity reaction. If a bump develops in that area after 48 hours, then the animal must have been previously exposed to tuberculosis. Johne's disease activates T cells against Mycobacterium paratuberculosis antigens. This results in granulomatous, or macrophage-dominant, inflammation within many tissues, but it primarily affects the intestines and lymph nodes. Here's a brief summary table of hypersensitivity reactions and the example diseases that we discussed. Thank you for watching PathoLogic, and we will see you in the next video.